All right, home hemo chest catheter setup. So this is the supplies that are readily accessible and organized by the machine, ready for use. I pull out the stuff that I'm going to need, lay it on the table, so that way I am not fidgeting through the cabinet to get everything that I am going to be using. So right here, you see I've taken off the old bandages, doing it slowly so that I don't pull the catheter, pulling the tape off. What you didn't see on camera was washing hands, putting on a mask and gloves. Just taking those gloves off with the used bandages, getting some hand sanitizer, rubbing that together so that way we have some fresh hands. We're going to get some fresh gloves on before we go on to the next step. One glove, two gloves. All right, so this is asking him if it's tender, checking for redness, drainage, any of those things around the site. Which you can't say it here, as he said no, he doesn't have any tenderness. You can see it's not red. This is the ChloraPrep. Go in on one side of the pad, go around where the access is open. You can see here, cleaning it, making sure that there's no crusties, no anything, just making sure it's all nice and clean. And then working your way out from the outside, getting all of the gunk from the bandages off, then flipping it over and repeating the process. So again, cleaning around the access point, making sure there's nothing there, keeping it clean, sanitary, letting that go, and then all the way around, getting all that yucky gunk off from the tape. And here is the drying process. So you want to make sure that it's completely dry. Once it's completely dry, what you can't see off camera is I am opening a new island dressing, checking to make sure it's still dry. Taking the new island dressing and placing it over the opening of the catheter, pressing down to make sure that it is covered and clean. From here, I will open a TAM or a dog pad, for lack of better words, and put it underneath his port so that way if there's anything that comes out, which you will see later, it gets onto that instead of him taping it in place so that it doesn't fall. So now that it's in place, I'm pulling all my supplies closer to me. We're going to get some rubbing alcohol. You're going to open that up and you're going to take off the red cap. I usually do red and blue first, or red first and blue. So here it is, cleaning it for 20 seconds. So rubbing it where the cap came off, cleaning it all off, making sure there's no dry blood from before or anything else on there. Constantly keeping that in your hand at all times. Don't drop it. This is plugging in a 10 milliliter syringe to go ahead and pull out that old heparin, snap it shut. Grabbing from here, you're going to grab a pre-filled syringe so that we can flush it back out, just to make sure that those lines are flushing backwards. They can pull and flush backwards and forwards before hooking them to the machine. So here I took out the heparin. Now we're going to put in the pre-filled. Open that line again. Push in the pre-filled, close that line clamped. And then we repeat the process on the blue side. So here's cleaning the blue. Got the alcohol prep, cleaning on the blue side, making sure there's no extra dry blood or anything that's on there. Keeping it nice and clean, making sure we avoid any infections. Here it is, putting their syringe on. Oops. Getting that syringe, unclamping, pulling the heparin out, clamping it closed, then grabbing our pre-filled, which you don't see here, but we're going to push the air out of your pre-filled a little So that way you're not putting air in the lines. You're going to disconnect the heparin and a little bit of the blood, connect your pre-filled syringe, unclamp, push it in, make sure that it doesn't have any. You're looking to, at this point, to make sure that you don't have anything. Like I can see, you see a little bit of blood. That's why we have the pads there. But at this point, you're making sure. Oh, we're going to pull our lines the off this thing. We're going to connect the red side. Going to connect it here. Then you're going to get your blue line, take off your Mr. Peanut, toss him away. It's nice to keep your trash can close by so that you can just keep things organized and going. Connect the blue line. You're going to put your safety on. Always have your safety. Clamp it closed so that it doesn't go anywhere. And we're ready to go get that first blood pressure and then unclamp the top and the bottom. And that is the easiest way. We're going to put the lines on the up so that they're there. So here's your lines. We're going to make sure they're unclamped. This is your post, your heparin that you're going to place in your lines. This is the end of treatment. So when you're pushing back the blood, you're going to close your red line. You're going to disconnect from the saline. You're going to put your saline on, flush that line a little with the saline that's there, clamp it closed. You're going to reconnect it to your saline bag, and you're going to open the top, open the bottom, make sure you're open, and then you're going to hit fill, and then the 277 milliliters of fluid are going to push back the blood that's in the line still. So here is the ending when you're finished with already rinsed back your blood. This is what you're going to grab a alcohol prep wipe because you did have a little bit of residual blood when you had your lines. You're just going to clean that off. Make sure it's nice and clean before you do anything further. So you're going to clean this again, get all that little extra blood that was there from the lines being connected. Don't ever drop your line when it's open. You're going to grab your heparin. You're going to put that in. Your heparin is going to keep the lines clear from any blood clotting in there. You're going to clamp it shut. And then you're going to put the caps back on. And that's one side done. Throw away your needles, and then you repeat with the blue side. You're going to grab So you're going to grab the saline off of the blue line. You're going to go ahead and take off your safety. Make sure you're clamped. Disconnect. Add the saline. Open the line. Push. And then add your blue line back to your saline bag so that it doesn't go anywhere. And you're going to repeat the process. You're going to get your alcohol swab. Make sure that you've cleaned up any residual blood or anything else that's on the line. Make sure it's nice and clean. Once you've got this, you'd like to do it for about 20 seconds. Don't ever drop your line. Get your heparin, connect your heparin, unsnap, put the heparin in the line, snap it closed, grab your cap. Disconnect your here. Connect your blue lines, make sure they're nice and tight. And then you can remove this for the next part. Like to take that, and then you're going to get a 4x4. You're going to open up your 4x4s like so. The 4x4 has two pieces inside, I like to open them up and then fold the flap up so that it covers the lines, and then tri-fold. So you're folding here and then folding it back this over itself. Make sure your gloves don't get in the way. You've got it there. And then I like to take a piece of tape, wrap it around the center to make sure that that doesn't go anywhere. And then I grab another piece of tape and tape it over the top just to hold it in place. And I grab another piece of tape to